Debmalaya Sinha, eminent endocrinologist from the city of Kolkata. Debmalaya, my question to you is, we have a number of medicines that we use in the management of type 2 diabetes. But you have your work, seminal work on that area which we rarely face. It's not that we don't face, but we are quite unsure, which is after transplantation. Do we use the same type of medicines or the choices do change a little bit?
So again, for most of the diabetes patients who are known diabetes prior to transplant, most of them would require, because they are long-standing diabetes, would require insulin. Most would require basal bolus. Some would suffice with twice daily premixed or insulin or a co-formulation along with the oral tablets. But for those who develop new onset diabetes, they also require initially insulin, but they can be managed with tablets. When it comes to tablets, again we must remember that post-transplant they do not recover their GFR fully. So we have to be very mindful, and that fluctuates especially in the first year of therapy. So we need to be careful with metformin. We can use if possible, but we need to be mindful of GFR, especially with regards to the DP4 inhibitors. There is good amount of data. Even with short-acting secretagogues like repaglinide and sulfonylurea, there is good amount of data. There is emerging data with SGLT2, but we need to be very careful that in this group of patients, the glycemic control will not be that great, and there is also the added risk of infection as well. With GLP-1, again, that's a good option, especially in obese patients, and it is effective also. But with regards to transplant medication, there might be some GI intolerance. That also we need to be mindful. So two important issues is we need to be mindful of the GFR, we need to be mindful of the drug interactions, and the third point is that in acutely ill patients, because transplant patients lot of times require several hospitalizations, we need to discontinue medications and go for insulin.
Thank you very much, sir.